Plasticity is actually a very important and a very relevant subject that we don't know a lot about, but is one that is an area for development. And certainly as we look to cure what we think are incurable diseases involving the brain, Alzheimer's, diseases involving dementia and other things, is going to be extremely critical in terms of understanding the basis for plasticity and in terms of how to modulate neuroplasticity. Neuroplasticity is the ability of the brain to adapt or to change over the course of time. There are two types of neuroplasticity that exist. One is called functional neuroplasticity, which is the first type of plasticity, and that's the ability of the brain to repair areas that are damaged. It's seen most classically in areas of stroke. For example, when an area develops a stroke and a part of the brain dies, patients oftentimes are left with neurologic deficits as a result. Conversely, however, in children, when you have brain tumors, for example, that involve critical areas, for example, the visual cortex, in infants, we can actually do surgery around those areas, and other areas of the brain will adapt to actually make up for the areas. And the other part is called structural neuroplasticity, which is the area of ability of the brain to develop, change its structure over the course of time through learning. What do we know about neuroplasticity itself? We know that it tends to involve the synapse, which is the area of connections within nerve cells within the brain itself. We also know that over the course of time, these connections tend to be very high in children. Between the ages of about birth to about 3 years old, there's a rapid increase in the number of synapses that are present. And then over the course of time, that tends to decrease as we get into adulthood. We also know that learning is related to what's called pruning or modification of function of these synapses. And there are multiple receptors that are involved in synapses, specifically NMDA receptors, which have very important roles of this. But the specific roles are largely unknown. As I mentioned earlier, we know that in adults, the ability of the brain to prune may decrease compared to what it is in children. However, there are ways to improve function or to improve plasticity. Among this includes exercise, rest, as well as things like mindfulness, meditation, reading, and things like that that are supposed to improve the function of the brain itself.